Welcome to Comcast Newsmakers. I'm Alicia Menendez. We're joined today by David Moore. He's the Senior Director of Government Relations with the Association of American Medical Colleges. Thanks so much for joining us.
Thank you for having me.
So we just had a continuing resolution that's going to maintain the budget through the year. There were some major cuts in that budget, one very near and dear to you.
That's correct. The funding for the National Institutes of Health, which is the major federal agency that funds medical research, received about a $300 million cut in the current year. That may seem like a relatively small amount of money in the context of the overall federal budget, but it's really a continuation of a trend that we are seeing where federal support for medical research is being eroded. For example, our calculations are over the last 8 years that NIH's purchasing power after adjustment for inflation has been reduced by about 15%. So that means less scientific progress and less hope for those families who rely on medical research.
And who are those families that rely on medical research?
Well, there are millions of Americans across the country who suffer from disease and disability. As a result of the federal investment in medical research through the National Institutes of Health, we've made tremendous progress against a number of diseases. For example, death rates for many types of cancer, for heart disease, for stroke have dropped dramatically over the last decades or so. But there are a lot of diseases where we haven't made as much progress. For example, Parkinson's disease. It's estimated that over 1 million Americans have Parkinson's disease, and it's also estimated that about 60,000 new cases are diagnosed in the U.S. each year. As a result of this lack of progress in these areas, we have what we call a health deficit. And as a result of that health deficit, as a country, we're going to spend close to $2.7 trillion in 2011 on health care, and the federal share of that is close to $1 trillion.
And so what do you say to critics who say you don't need federal investment in programs like these because really they should be driven by private sector investment?
Well, medical research is actually a very good example of the partnership between federal support for basic research and then the private sector support for the more applied research. What we've seen over the years is that industry is not willing to support the types of basic studies that are funded through the National Institutes of Health. Once the basic research has been done and we reach points where we can see potential clinical applications, then industry is much more willing to step in. So the success of medical research in this country has really been this partnership with the federal government supporting the preliminary studies and then industry coming forward with the more applied research.
And so do you see yourself advocating Congress to increase funding in the next fiscal year?
Well, we would like to see the investment increased, but I think the political realities we're facing are that it's going to be, our main challenge is going to be to try and maintain the level of support for NIH. Congress and the President are engaged in a very serious discussion about reducing the federal deficit, and that's something that has a tremendous impact on the future of everybody. What we're hoping is during those discussions that the President and Congress consider those types of investments that are going to make America stronger, both in terms of the health of Americans as well as our economic strength.
And how do you communicate about this health deficit to the average American?
Well, I think most Americans understand the impact that disease can have. I mean, we all have loved ones or members of our family or people that we know who suffer from disease. And it creates a tremendous toll on us as a nation and as individuals, physically, emotionally, financially. So I think people really are looking for ways to help with these problems. And as I say, medical research for many types of conditions like Parkinson's provides the best and in some cases the only hope for improved quality of life.
Well, thank you so much for joining us today. This was a pleasure.
It was my pleasure. Thank you.
If you want to learn more about what's going on in your community, you can go to Comcast On Demand and click Get Local. For Comcast Newsmakers, I'm Alicia Menendez.